Good afternoon, everyone, and welcome to the CHO2 launch of the Patients Deserve Better campaign for community neurorehabilitation teams. My name is Mags Rogers. I'm the Executive Director with the Neurological Alliance of Ireland, which is the national umbrella for over 30 neurological charities throughout Ireland. Our campaign, our Patients Deserve Better campaign, is calling for a network of 9 community neurorehabilitation teams, one in each of the 9 HSE CHO areas around the country. CHO2, as you can see from the slide there, covers the counties of Mayo, Roscommon and Galway, and it currently lacks a dedicated community neurorehabilitation team. At this online webinar this afternoon, we'll hear from local patients, family members and clinicians about what impact this continues to have on people living with neurological conditions throughout these counties. I should say from the start that local TD and Minister for Disability, Anne Rabbitte, has recognised the vital work of community neurorehabilitation teams and has secured funding for a team in last year's budget for CHO2, and she confirmed that on the 10th of May this year. Our event today will stress how important it is that team is established, that team is put in place as soon as possible. Unfortunately, what we have seen in other parts of the country is a significant delay in some cases between funding being available for a community neurorehabilitation team and that team being put in place. So, for example, in CHO 6 and 7, in Kildare, West Wicklow and Dublin, funding was put in place in 2020 and the teams still haven't been established. So our event today is warmly welcoming the funding that Mr. Rabbitte has put in place, but really emphasising that for people with neurological conditions, for people needing community neurorehabilitation services, the sooner that a team is put in place, established in CHO2, the better. Before I introduce our speakers today, I just want to outline briefly what it is a community neurorehabilitation team and what it does. So these teams are where all essential services from speech and language therapy to physiotherapy to occupational therapy, neuropsychology, social work, it's where all these disciplines come together in a multidisciplinary team to provide vital services to people with a wide range of neurological conditions. Where these teams are up and running, and bearing in mind they're only up and running in 2 of the 9 CHOs around the country. The teams are up and running in CHOs 1 and 3, which are Limerick and in the northwest in Donegal. They provide a vital service, not only providing access to those therapies, but also providing a vital local hub and linking people to other supports, such as those provided by the network of neurological charities on which people are so reliant. These are just some of the organisations that are members of the Neurological Alliance that are supporting our Patients Deserve Better campaign, and I'm delighted to have so many of them represented at the webinar today. Just in terms of housekeeping, we're delighted to have our audience today, including local elected representatives. We'd encourage them to introduce themselves via the chat or via the Q&A and let us know that they're here. Also, if you have a comment or question, please do pop it in the chat. And as I go through the speakers, I'll try and do my best to answer your question today. I just want to hand over at this stage to our first speaker, Dr. Tom Walsh, who's a consultant geriatrician and stroke specialist in Galway University Hospital. And Dr. Walsh is going to speak from the perspective of the pathway for stroke patients in CHO2 and how important it would be for them to have access to a multidisciplinary team. So I'll hand over to yourself now, Dr. Walsh.
Thank you very much, Max, for inviting me and to the wider community in the the Neurological Alliance of Ireland. I really do appreciate this opportunity because this symposium touches a topic very, very dear to my heart. I suppose I am a stroke physician, but I'm also a geriatrician, and I suppose I see it firsthand, the suffering and the absolute despair that sometimes patients and their families, go through at a time of great vulnerability in their lives, both when they have something like an acute brain injury such as a stroke or a head injury from other trauma, or indeed more chronic progressive neurological disorders like Parkinson's, multiple sclerosis to name but a few. So, certainly those of us at the front line see the suffering of patients and the great needs. And I suppose because of the nature of my role, I'm very geared to I suppose, what happens at the front door, so to speak, in terms of delivering thrombolysis and making sure people get appropriate care if they need to go to Beaumont for mechanical thrombectomy, which is the removal of clots from the brain, etc. That's all the hyperacute side of things. And very much, I think, as physicians, we're often very guilty of just looking at the front door end. But I, as a geriatrician wearing that hat, I'm well aware that, I suppose, the patient's journey doesn't end when I've finished dealing with in the emergency room or on the stroke unit, as those of you who have suffered on a stroke will know. That's only the very beginning of the process. And I suppose that's why I feel so strongly about the role that you're all playing today in advocating, both from our healthcare leaders and from our politicians, elected politicians, that this is a vital service that is, something that it's an absolute need and entitlement of people with neurological conditions to services that will allow them to achieve their full potential as human beings, and for them to live a life that is full and dignified. Because I think it's fair to say that people, their whole life is just absolutely turned upside down and absolutely just rent apart. And it doesn't just affect the patient themselves, it affects their families. And just, I suppose, purely from the stroke perspective, sometimes people see stroke as an older person's condition, and nothing could be further from the truth. While it's a very important thing to care for people who are older who have stroke, of course, but people often forget that about a quarter of patients with stroke are under 65. So it's not at all unusual for me to have somebody with a stroke in their 30s and their 40s on the stroke unit, and even sometimes people in their 20s. So it's a devastating event. And I'm afraid those patients often suffer with great dignity, but also in silence. And it's so important that, I suppose, groups such as the Neurological Alliance of Ireland are there to advocate. And I suppose our roles as physicians and healthcare providers in general, is to support you in your advocacy for those patients, because sometimes we lose sight of the bigger picture as clinicians on the ground. We're just there to problem solve on the ground, and whatever happens acutely, that's what we deal with. We don't really think too much of the wider pathway, and that's what this is all about. This focus on developing community neurorehabilitation teams. And I suppose, stroke, while stroke, I suppose, is my area of expertise, I suppose it's certainly true to say that, I suppose, stroke isn't all we're talking about here today, but stroke can be the stroke pathways that are being developed through the National Stroke Programme that I believe my colleague, Professor Ronan Collins, has alluded to in an earlier meeting. It is a key pillar of the National Stroke Strategy that we deliver rehabilitation and restoration to life. And I really like that phrase, restoration to life. It's not just doing rehab to somebody, it's actually giving them back their life. And that's what people deserve and require. And stroke, it's often forgotten, but it's the leading cause of adult disability in Ireland and in the Western world, and it's the third leading cause of death after cancer and heart disease. And I'm not saying for a moment that people with cancer and heart disease shouldn't get resources. Of course they should, but when you look at in terms of the pecking order of resources, where to come and what the gap is between what stroke patients get versus those who have cancer and heart disease, and it's not a competition between us all about who gets the most, but it's just to say people should get their due, shall we say, their due share of the pie. And even those then with other conditions that are chronic progressive neurological conditions that I often come across as geriatricians, such as Parkinson's disease, instead of MF, those people again are at a greater disadvantage again. People with chronic neurological disorders are a greatly disadvantaged group in our society. And depending what statistics you pick, even alone for stroke, about 30,000 people at least suffer with the effects of stroke in the community, and depending on what statistics you want to believe, a huge gap we have in Ireland was even measuring the problem. The scope of the problem is such to the point where we're not even sure how many people live with the residual effects of stroke alone, not to mind other neurological conditions. And some estimates would suggest that there are perhaps up to 90,000 people living with the effects of stroke in the community, though those figures are not certain. It's based on extrapolation of international data for our population, etc. So certainly it's a huge problem. And I see it firsthand that 70% of people who are discharged from hospital following a stroke have some form of disability, and 50% of those actually have either moderate or severe disability. Now, I suppose we are lucky in that we do have access in Galway, and Galway was one of 3 pilot sites back in 2011 who actually, shall we say, we volunteered to be part of a pilot program for a program called Early Supported Discharge for Stroke. But that's a very time-limited process. So patients are usually discharged within 6 to 8 weeks. And when people come back to me in clinic after 3 months, always say, how bereft they feel. They've just been, left high and dry effectively, because there's often very, very long waits for access to therapy in the community. It's not the people who work in the community's fault, but there's just purely an access problem here in terms of resources. People have huge long waiting lists for occupational therapy. Speech and language therapy is a huge gap for us in the community in Galway here as well. And even physiotherapy can be challenging. So those people often, I feel we've abandoned them, and often when people come to the clinic, it's a huge issue for them. And I think, and again, as I said, I keep saying this, but stroke is not the only show in town. I mean, that's only one section of the community of people who deserve access to proper neurological rehabilitation. And I suppose, even over my own career, since I've been a doctor in 1998, qualified in 1998, there have been three large, three big studies and documents published, reports published by the government. First was 1998, where they looked at the needs of the aging population in the years ahead. Then followed on in 2011 and 19 by the National Strategy for Neurorehab. Again, more recently, the National Stroke Programme has been published and has been finally adopted after 10 years of campaigning as policy by the HSE. So we're really at the very, we're at the foothills of the mountain here in terms of the mountain we need to climb. And sadly, none of these reports have been implemented in full. There's been very, very great groundswell of support. I mean, nobody's saying that people don't want to support, but I think it's all about what you do. We need to prioritize, and we need to focus the minds of our political leaders, and also of our healthcare leaders, into making sure that this is not falling on deaf ears, that it's not just another report sitting gathering dust. We need to implement this. And I suppose it's really just not good enough. I mean, access of patients with chronic neurological conditions, access to services for them in the community to allow them to achieve a full and dignified life. That, to my mind, is a human right. It's a republic. It's the 21st century, and it's a right, in my opinion, for people to have this access. It's not just that they deserve this. It's a right. I think people need to get more. I think. We need to get firmer. I think that this is just not, we should be, obviously we're great for support, but we need to demand it. I mean, it's not just something that people, it's not an option not to give it. And I suppose in that vein, it's obviously, great to see, and it's a great, candle of hope, I suppose, in all the darkness, that finally, there's an implementation process going ahead, as you said, of the National Neurorehabilitation Strategy. And it's wonderful to see the announcement of 9 community rehab teams. And as you said earlier, only 2 of those teams are currently in action. That means that 15% of people who have chronic neurological conditions can access these services. So that's, the vast majority of people in Ireland with a chronic neurological condition cannot access proper neurorehabilitation. And that, to mind, that is disgraceful, and there's no other word for it. That is just not acceptable. And I was very heartened to see Minister for State for Disability, Ms. Anne Rabbitte, announcing the funding for 2 more teams, and one of those will include my own CHO, Galway, Roscommon, Mayo. And that's a wonderful initiative, and I can't say how heartened I am by that announcement. But we all know, of course, as you said earlier, Mags, it's not just about getting the funding. Now we need to get the process in motion to actually get that funding into troops on the ground, so to speak. So there are often multiple, and I've seen it myself when I'm trying to recruit staff for our early support discharge team, when money is there and there's delays in recruitment and delays in the constitution of the teams. Delay here is not an option. And I suppose that's where we, as a community of healthcare users, be they families, patients, their carers, loved ones, healthcare professionals and advocates, we really must demand rapid action to ensure this funding is translated into action as rapidly, and our patients and their families deserve nothing less. And thank you again for this opportunity to allow me to advocate for this service. Thank you.
Thank you so much, Dr. Walsh. And I think that's a very passionate plea on behalf of neurological patients, not just stroke patients, but all neurological patients in Galway, Mayo and Roscommon, that we do need this dedicated community neurorehabilitation team as soon as possible. And as you say, this is not an add-on service. This is a vital part of care for people with neurological conditions. And you just outlined there what we hear over and over again, that people feel like they've dropped off the cliff, that they get a limited amount of therapies, and then it comes to an end, and they really struggle to access that vital speech and language therapy, physiotherapy. I'm going to move on now to Delia Costello, who is an incredible stroke survivor from Mayo. And Delia will talk about her own experience. But Delia, I hope you don't mind me sharing just when I'm talking about it. You talked to me about that experience of that there was 6 sessions of physio available to you, and only that your family stepped in and organised physiotherapy separately for you. Six sessions would have been all that you were entitled to, which is only scratching the surface of the need that you had at the time. But look, Delia, I'll let you explain in your own words. So I'll pass on to you. I'll thank Dr. Walsh and pass on to you now.
Thank you, Dr. Walsh. In 2016, I had 4 strokes, and I'm very grateful to be here. June 2016, I was at work, felt unwell. I was brought to my doctor to be told. He took my blood pressure and it was good. He thought I was stressed as my husband had been just been diagnosed with Hodgkin's lymphoma. When at home, I got a pain in my left eye going over to my right eye. It was like as if you ate on a nice pop. It just consumed me. I took some paracetamol and I took some Nurofen, but nothing was helping. So when my husband came home from work, he said, "That's more than stress, Delia. I'm going to bring you to the local hospital." So he brought me to the local hospital. I can remember leaving the door here, and I can remember getting near Castlebar and I saying, "Well, I'm okay now." But after that, I can't remember anything till basically the best part, as we say, you could say I'd lost, I suppose, a good month of my life anyway. It would have been when I would have been back in Galway again. I went from Castlebar to Galway. The doctor in Castlebar was geriatric, is that what you called it? That would have been his title, I suppose. But where my family would have seen me going down, he was treating me for migraine, and then he thought it was my nerves, and my family said, no, you know, you don't know our mother. But anyway, they asked for me to be sent to Galway, and basically he didn't agree with that. So they signed me out of the hospital and they got a private ambulance and brought me to Galway, where thankfully I was seen to, and I wasn't under Dr. Welsh now, I was under Lord of Mercy, and I'm Dr. John Lynch. And from there, he would have sent me to Beaumont, and I would have spent, I think it was 2 weeks in Beaumont. I can't remember too much of that. It's like a nightmare to me, all that. But back in Galway, I can remember I was back, basically getting back to myself. So where I had great physio and great, as you said, there was all the facilities was there, all the treatments, all the services. The day I was leaving, the day I was getting ready to leave that weekend, the social worker, she was going around and she was giving out booklets. And in those booklets was all the services that would have been in Galway. So I would have asked for a booklet, and I was told that it wouldn't be any help to me because it was all in Galway. And once I went home, I was back in the Mayo services. So back in the Mayo services, and I started going to the pre-stroke support group. And there I met a lovely nurse. There was the nurse, she was the stroke nurse in the local hospital. And we spoke about different things improved, and I mentioned about the booklet. So she took that on board, and they have that in the hospital now. But getting back to the services here, when I came home first, there was no physio. The family was looking, and they were told that there was a waiting list. So they started paying for me to have private physio. So I was having private physio, and then I got an appointment for physio in Claremorris, and I would have went to that. And on the 6th occasion, I wasn't even told that I get 6. It wasn't until the 6th was up. And then they said to me, "That's it now." And I said, "What do you mean that's it now?" And they said, "That's you get 6 sessions and that's it." So since then, I would have been talking to a physio, and I asked her about, I said, "Where does that go to? People needs more." And she said, that's all we're allowed to give is 6 sessions to a stroke patient, because other than that, I suppose they could be going, some people could be maybe going back all the time or whatever, I don't know. But services are badly needed here in Mayo. There's within our local hospital, there is no cardiologist, there's no neurologist. I know there's doctors that have an interest in different in the cardiology and in the neurology, but it's like myself, I have a great interest in flower arranging, but I'm not a florist. And I know that's only 2 of the services that I know of. There is other services as well. And I'm very happy that what let's say Anne Rattigan, the minister, has announced for the CH2 funding. And I'm looking forward in time, as we say, I know we'll say at least once it's in place now, we said they can advertise and look for, I'm sorry now, this is part of my aphasia. The word is there and it won't come out for me.
You're doing great.
For the physios and for the occupational therapists, and there's a word for that, but it just won't come to me at the minute. But so I'm looking forward in the future that there will be services there for me. Thankfully, I'm doing good. I do my exercise classes and I push myself and I do the best. We say the type of a stroke that I had was sorry, now I wrote down here because the head is not what you'd call the best. RS, where is it gone to? Oh yeah, RSV syndrome. Now I focus on the word reversible on that because it's reversible constructive, I think it is. I have it wrote someplace else now, sorry. But I focus on the word reversible. I did not, as I said, I did my rehab in Merlin, which was very good. And the physio that I got privately was very good. And I still do physio and I do exercise classes, but that's all on my own and my family. If my family hadn't stepped in, I wouldn't be here today. I'm very grateful to be here, and not everybody has the family that I have, and I would love to see these services put in place, especially for people. There's a lot of people that haven't got family, and there's a lot of people that their families wouldn't be as vocal. So I would really love, as I said, the main message I want to get across is the funding has now been announced for CHO2 coming next. Community news, is it?
The community neuro team.
The community neuro team in place. So I'm looking forward to all that, and hopefully it's going to be sooner than later, because we hear about a lot of things happening, but everything seems to take so long, you know. So that's really my story. I don't know if I have anything left out or not now, because I went rambling there a bit.
You did absolutely great, Delia. It's a powerful story. And I talked to you on the phone yesterday, and I was struck by your determination, your family's determination to put a pathway in place for you, you know, to get the services that you needed and to fight for the services that you needed. But I think what really comes across from what you're saying is they shouldn't have to do that. And if someone didn't have that family network around them, they wouldn't maybe, you know, get the access to the services that you managed to get.
Yes.
I know that you talked to me about getting out of hospital and still not being able to walk, and the idea that you'd only have 6 sessions of physiotherapy, you know, when your need is that great, it's just not enough. And the sooner that we have a community neurorehabilitation team in place for people like yourself, that they don't go through what you went through and what your family had to go through. So thank you so much, Delia, for sharing your experience today and giving such a good account of your own experience. Thank you.
I hope I did, because I got a bit muddled in the middle there, but if there's anybody that needs to ask me anything, that's okay too. Thanks.
You have a great, it
Thank
came across really, really well, Delia. Thank you so much. And thank you to our members, Cree, Heart and Stroke, who are based in Galway, and they linked us with Delia, and they've been a very strong supporter of the Patients Deserve Better campaign throughout CHO2 in the weeks leading up to this launch. I'm going to go to our final speaker, Derek Reedman. He's a family member of a person with Huntington's disease. Derek, I'll get you to talk about your own family member's experience and how important it would be to have a community neurorehabilitation team in place for your family member.
I'll give you a bit of background first on Huntington's disease. So it's a very progressive neurological disorder. It's inherited from a parent. So every child has a 50% chance of inheriting the Huntington's disease gene. And the onset of symptoms usually start around the age of 30, but it can be anywhere between the ages of 30 and 50 and earlier or later. In Ireland, there's about 700 people living with Huntington's disease. There's probably about 3,000 people at risk of it. Usually from the first onset of symptoms to death is between 10 and 25 years. Usual causes of death in people with Huntington's disease is aspiration pneumonia and other infections like that. And the second or third leading cause of death is actually suicide for patients with Huntington's disease. My sister, she was a special needs assistant in Galway, and she worked there for many, many years. She's a very organised person. She loved her job. She had always been extremely social. Over the years, she started to see a breakdown in her mental health. It was declining, and she ultimately wasn't able to work because of it. About 10 years ago, in her mid-50s, she noticed things were not right health-wise. It wasn't any specific thing. It was just a gradual onset of minor things that started to build up. It started off things like her balance just wasn't right. She just felt her balance was off a bit. She'd be a bit dizzy when she was trying to walk. She'd sort of veer off across the road or out into the pavement. I mean, I remember going to the Galway market with her at one point, and she spent more time apologizing to people for bumping into them. So I actually linked arms with her, and I actually struggled myself to walk in a straight line with her because she was very wandering around so much. She went up to visit her daughter in Dublin, and while she was there, she was going to visit a relative, and that relative is about a 10-minute walk away from where her daughter is. And so her daughter drew a map, even though she had been there many times. She actually walked 6 kilometers in the wrong direction before she realized she was going the wrong way, and she made a call to her daughter and said, "I'm not sure where I am." It was sort of that sort of thing. And in the first few years, a lot of focus was on her mental health, not really on the neurological symptoms that she was having. And she was told that a lot of her symptoms were psychological. She had actually started to develop a mild slur in her speech. In fact, she was visiting her other sister in Kilkenny one time, and she was only a few kilometers away from her sister driving, and she had to stop someone and ask for directions. And that person said to her, "Are you sure you should be driving if you've had a few drinks?" She doesn't actually drink at all. Maybe she's, if she ever drinks, it's 1 glass of wine at the most, and that is very, very rare. But that was an example. And another example was she was going into a local shop, and she was not walking in a straight line as she would normally, and she was a bit slurred. And actually, a report went back to her husband that she'd been seen drunk at the local shop at midday. Things like this. She was admitted to A&E a few times with falls. She was also admitted to A&E a couple of times after attempting suicide because she was so distraught over not being able to get any help or being able to give any diagnosis with all of her symptoms that just kept developing more and more. Her relations with her own family members started to deteriorate a lot. Then she started seeing more and more professionals, and she was diagnosed with fibromyalgia initially, and there was a number of other diagnoses. She was diagnosed with functional neurological disorder. We actually went to a specialist in St. James's in Dublin. I went with her, and we sat there, and this consultant actually started asking her about her history and her family history and her symptoms and all the rest. And it was clear from the very outset that it wasn't functional neurological disorder and that she had. But this consultant actually spent a whole hour talking to her. And when we left there, she said it was the first time ever anyone had sat down with her and gone through her whole list of symptoms and experience and everything like that. And this consultant said that she was going to write to a neurologist in Galway. So we then got a neurologist appointment, and she was tested for HD in September 2021. Yeah, September 2021. Now, it was just another test. You know, she had that many tests over time. It was just another test. But in January, then she had an appointment. In January 2022, she had an appointment. This is 10 years after her symptoms started. She had an appointment with the neurologist. The neurologist told her at that visit that she had Huntington's disease. And there was a fair bit of discussion, which I don't actually remember an awful lot, but we were given a leaflet and sent home, basically. That really didn't tell us a lot, but when we looked into it, we discovered that we all had a 50% chance. Bearing in mind she has 5 siblings and 20 nieces and nephews. Therefore, all of us were at risk, had a 50% chance of developing Huntington's. There was no referral for the family as a whole to any services because the services just were not there. My niece, her daughter, then took over in terms of finding out what was necessary. Used Google, and Google is the worst thing you can do. But the one thing Google did do is direct her to the Huntington's Disease Association of Ireland. And that is what made the biggest difference. I think Patricia in the Huntington's Disease Association of Ireland was able to say, well, this is the services that you need. You need speech and language, you need physio, you need a whole range of services. And that really was the beginning. But what we've discovered is that all of these services were just not available. There was no coordination of any of the services. So, you know, there was not one person that you could go to that would say, yes, I'll refer you to this, this, and this, and this. So, in fact, it was Patricia and the Huntington's Association of Ireland that actually gave us a list and said, these are all the services that you're going to need. You're going to need to go to your GP and get referred to all of these services. The GP didn't have any knowledge of, or have any great knowledge or understanding of Huntington's at the time. But just to give you an example of the list of services that we actually require. So there's the GP, obviously. There's the neurologist who is in Galway. There's a HT specialist, Dr. Orla Hardiman, who's based in Beaumont. Niall Pender is the neuropsychologist in Beaumont. There's a researcher in Beaumont as well, because there's actually a HD research team there, and my sister is involved in that. There's clinical psychologist in Beaumont. See, a lot of these services are in Beaumont. They're not actually in Galway. And Galway is, you know, my sister lives in Galway. She needs these services in Galway. Her mobility is a big issue. So traveling up and down to Dublin is not really appropriate for her. She needed a psychiatrist, which would be based out in Ballybaan in Galway, social worker out in Ballybaan in Galway, disability officer, who's the Galway HSE. Physio, as already mentioned there by Delia, 6 sessions of physio. Someone with Huntington's needs physio for life, and they should start physio really early on when they see these symptoms occurring, because there's lots of involuntary movements, there's muscle tightness and all the rest of it, and they really need a lot of physio. Now, she's getting physio, but it's privately. She's paying for it herself. Speech and language, another huge thing for people with Huntington's, and speech and language is actually based in Tuam, but we had to fight for every single one of these services. Nothing came free, nothing came easy, everything had to be fought for, and nothing centralized. You can't, my sister lives about 10 kilometers from Galway city. There's not even a bus that goes into Galway city from where she lives, which seems to be crazy when you're only 10 kilometers out. She's still waiting on a dietitian. As I mentioned there, aspiration pneumonia is a leading cause of death. Without speech and language therapy and without dietitian, you're very at risk of this aspiration pneumonia. She needs occupational therapy. She needs public health nurse. She's working currently with a local council to try and get a grant to renovate or adapt her home for the disability. Last year, we went to the Huntington's Disease Association of Ireland annual meetup, where there was family members, carers, and patients with Huntington's. And we went there as a family, and it was the first time ever we met other people with Huntington's. It was the first time we got around the table. In fact, Minister Rabbit was at that and gave a speech at that and made commitments there. And in fact, only last week, there was an announcement that there would be a clinical nurse specialist based in Galway and another one in Beaumont. For HD patients, which, as Dr. Walsh says, the actual recruitment time and the training time of that is actually it can take a long time. But we would hope to see that happen as quickly as possible, really, to get out. So I suppose my message is that there is no connectivity between all of these services. It is very much a neurological disorder. It very much is very, very progressive. It just continues and continues and continues. It becomes more and more progressive and worse and worse and worse. And as I said, death occurs between 10 and 25 years. So you can imagine it is just progressively getting worse all of that time. And all of these services are needed on an ongoing basis. It's not 6 sessions of physiotherapy. It's dozens and dozens of sessions of physiotherapy. It's constant speech and language therapy. There's a huge mental health aspect to all of this. So you need neuropsychology and you need neuropsychiatry. All of these services have to be involved. I suppose that's the story where we are and the services that we're looking for and that we badly, badly need in Galway.
Thank you so much, Derek. And it's an incredible, again, your incredible experience and testimony to just feeling that, you got the diagnosis and then there literally was nothing really for you. And it's not to take away from the really vital work of the neurological charities that are in the community, but these teams are such an important part to work with those charities, these community neurorehabilitation teams, to be available at that front line of providing those vital therapies in the community. And I think the strong message from all our speakers this afternoon, while we do welcome the funding of a community neurorehabilitation team in CHO2, really there's an urgency about this for people living with neurological conditions. Time is the one thing that they don't have. People living with, people diagnosed with neurological condition, people recovering from the likes of stroke, people living with progressive neurological conditions really need the help now, really need the access to therapies now. So we would encourage all of our elected representatives on the call. We will be watching closely to ensure that this team is up and running soon. We presented to the Joint Oireachtas Committee on Health just over the last 2 weeks, and we received a commitment there and from the HSE that the teams would be operational by the end of the year in areas where they had been funded. We'll certainly be watching that closely. In the meantime, I would ask people to visit our website, patientsdeservebetter.ie, for more information on this campaign. Thank you to all our incredible speakers. Thank you so much for your bravery and your testimonies today, and for showing and highlighting the need so much, and to Dr. Walsh as well, from a clinical perspective, of highlighting the need in counties Galway, Roscommon and Mayo for a dedicated community neurorehabilitation team. And the loud and clear message to the elected representatives today is the sooner the better for that team to be established. Thank you all so much, and good afternoon.